Ready to move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. Mr. Speaker, can the ferry to Maine produce more benefits to Nova Scotia? That's really the question that's on the minds of many Nova Scotians. And there are many questions about the way this government has managed this file. Mr. Speaker, this file has been mismanaged in so many ways. And the only way to make this service work better is to distill it down to the facts. So I'd like to ask the Premier, in the interest of transparency, will the Minister table the economic impact study that shows the many benefits of this service to Nova Scotians?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. Mr. Speaker, as he would know, that ferry had been severed by the former government. We saw devastation to the tourism industry, particularly in southwestern Nova Scotia, but indeed across the province. We've made that investment in that ferry, Mr. Speaker. We've continued to see a record-growing tourism years, this third consecutive growth. All the positive investments that are taking place down in southwestern Nova Scotia. Mr. Speaker, in his question, he suggested that the only thing on the minds of Nova Scotians was in his question. The reality is, for many Nova Scotians, they're wondering why the honourable member won't support that ferry, but he supports the one in Pictou.
The Honourable Leader of the Official Opposition on his first supplementary.
Thank you, Mr. Speaker. And I do support the service. I do support the service. I see the value that it can bring to Nova Scotians. The issue here, Mr. Speaker, is this government does a significant disservice to the long-term sustainability of the service by hiding information, by mismanaging the file. The Premier, I didn't hear the Premier commit to tabling an economic impact study. He doesn't want to talk about the facts. And if we want this service to improve, we can't hide information. We need to be showing the benefits to the Valley, to HRM. If this government truly supported it, they would provide information that Nova Scotians could absorb. So I'd like to ask the Premier again, will the Premier table the economic impact study that shows Nova Scotians the benefits of the
Honourable Premier.
The honourable member for the question. Again, I want to tell him 50,000 people have chosen to come to our province through that ferry service, Mr. Speaker. The number continues to grow. You would also know the investment by the private sector, Mr. Speaker. Rod's Hotel alone, Mr. Speaker, there's a few $1 million being invested back into the economy of that community. We're hearing from tourism operators around the province, Mr. Speaker, who are supporting that service, recognizing it's our connection to an international market, Mr. Speaker. It's one that we're very proud of, Mr. Speaker. All of the money that we have spent year after year has been disclosed, Mr. Speaker. What the honourable member is referring to is an aspect that is proprietary information to individuals, Mr. Speaker. It's no different. It's no different that every day we table in this House, we award tenders for those who pave roads in every constituency of this province, Mr. Speaker. We don't disclose how much profit they're making, Mr. Speaker, or what it's costing us for them to manage those particular projects. That is how they drive the best price, Mr. Speaker. That's what we call a competitive marketplace. This proprietor, Mr. Speaker, this company competes globally, Mr. Speaker. That is where we've been able to get the best price, Mr. Speaker, for the taxpayers in Nova Scotia. We're going to continue to drive that. But I want to remind all members of this House, the global number has been disclosed every year.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. And we're going to have all kinds of time to talk about that particular situation in court, where this government is forcing us to go to get the information. What I'm asking about is the economic impact study. And this province, this government has...
Order, please. The Honourable Leader of the Official Opposition has the floor.
Thank you, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. By not performing an economic impact study, which the Premier's just acknowledged they haven't, by not performing an economic impact study, they are doing a significant disservice to this run. If they would do an economic impact study, then we could see what is possible. Maybe we could be using that service to promote the film festival and bring tourists and attracting. There is so much we could do. But this government mismanages every single aspect of this file. I'd like to ask the Premier a third time. Has he bothered to do an economic impact study of the impact of that ferry on this province?
The Honourable Premier.
I appreciate the honourable member for the question, Mr. Speaker. The reality of it is he has not supported this ferry service, nor has his party, Mr. Speaker. The reality of it is, in the last election campaign, Mr. Speaker,
please, the Honourable Premier has the floor.
Last election campaign, Mr. Speaker, they ran against that service, Mr. Speaker. Nova Scotians sent them a message,
Order,
Mr. Speaker.
Please. Order, please. The Honourable Premier has the floor.
Mr. Speaker, the reality of it is, Mr. Speaker, the leader of the Conservative Party has not supported this service. Mr. Speaker, he's continued to undermine the private sector entrepreneur, Mr. Speaker. If we continue to follow his path, Mr. Speaker, we would drive the economy to the ground.
The Honourable Premier has the floor.
The reality of it is, population is up, the economy is growing, more young people see a future for themselves in this province, Mr. Speaker, and more importantly, Mr. Speaker, the global community is wanting to come and visit, and one of those ways is through that ferry service.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, in Canada as a whole, there are 5.5% more people working today than was the case in 2013. But here in Nova Scotia, we have less than 1% more people working today than in 2013. At the same time, we know from the Intergovernmental Panel on Climate Change that governments have 12 years to lower greenhouse gas emissions if we're to mitigate the most serious effects of climate change, and that major job-creating investments will be required in order for this to be accomplished. Will the Premier agree that there is a real need in Nova Scotia today for a plan for the development of green jobs so that we can both improve our economy and fulfill our environmental responsibility to the world?
The Honourable Premier.
Mr. Speaker, the unemployment rate in the province is at an all-time low. Since, Mr. Speaker, they've been counting that statistic. I want to remind the honourable member the economy is moving in the right direction. More young people are attached to the workforce looking for job opportunities here. They see a future for themselves and their families. Through successive governments, Mr. Speaker, starting with the former Environment Minister from Kings North, Mr. Speaker, was a Conservative member through the New Democratic Party and continued through our two administrations, Mr. Speaker. We've continued to make sure that we reduce our carbon footprint, we lead the country in the reduction of greenhouse gas. And of course, part of that is ensuring that we have created economic jobs associated with the green economy. He would know Efficiency Nova Scotia is currently a standalone Crown Corp that is providing good economic jobs, not just for those people, Mr. Speaker, that are working in that particular entity, but across the province in how we're helping individual Nova Scotians reduce their footprint.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, the Premier will also acknowledge, though, that when you exclude Halifax from the calculation, there are almost 9,000 fewer people holding jobs in Nova Scotia today than when this government first came to power. And at the same time, internationally, $500 billion is being invested every year in renewable energy and energy efficiency. So will the Premier acknowledge that a bold green jobs plan is necessary for us, both for our environment and for us to receive a significant share of the world's investment in this field?
Yeah. The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. I want to tell him that the policies in and around reducing individual families and communities' footprints is not exclusive here in Halifax, Mr. Speaker. That money is being distributed across the province, providing economic jobs through the very initiative that the honourable member is referring to. We should be proud of the fact, Mr. Speaker, that we're leading the country. When it comes to the reduction of greenhouse gas, we should be proud of the fact that all three political parties in this House have continued down the same path. No matter what happened on Election Day, we continued down the path of improving our environment for the next generation, Mr. Speaker. But he should also acknowledge that the economy has never been better in Nova Scotia, Mr. Speaker. He should also acknowledge, Mr. Speaker, third record season in tourism. He should also acknowledge population is at an all-time high, Mr. Speaker. Consumer confidence is at a high, Mr. Speaker. Consumer consumption is growing, Mr. Speaker. That is not isolated to just Halifax. That is around our province.
The Honourable Leader of the New Democratic Party on his final supplementary.
I would wish, Mr. Speaker, to acknowledge this, that the Intergovernmental Panel on Climate Change Special Report on Global Warming last October concluded that limiting global warming to 1.5 degrees is going to require what it called a rapid escalation of the level of ambition of all levels of government, including subnational levels like our province. Mr. Speaker, our party's emissions reduction target of a 50% reduction from 1990 levels by 2030 puts Nova Scotia on a track for net zero by 2050. The Liberals' target does not. Does the Premier really think that his government's emission target qualifies as a rapid escalation of the level of ambition, as the IPCC puts it?
The Honourable Premier.
Mr. Speaker, again, I want to thank the honourable member for the question. He would know, Mr. Speaker, we're 30% below 2005 targets as we speak today. The national government wants us to be there by 2030. Our government, our province, of all political parties, will have us there today. Mr. Speaker, if we continue on the path that we're going without doing anything else, we'll be at almost 50% by 2030. But of course, we know there's more work to do. We're not going to stand still. Just reminded the honourable member we're continuing to invest through Efficiency Nova Scotia that will then continue to drive job opportunities, not just here in Halifax, Mr. Speaker, but across the province. We're going to continue to make sure that we leave this province and this environment in a better place, Mr. Speaker, than when we received it. Our children and grandchildren depend on it.
The honourable member for Northside Westmount.
Thank you, Mr. Speaker. Mr. Speaker, let's be very clear. The PC caucus supports, and I personally support, a ferry service between Nova Scotia and Maine. And the Premier can say all he wants, Mr. Speaker, but that's not actually the case. Last month, the Minister was asked for details about the provincial economic impact of the ferry.
Order, please. Order, please. The honourable member for Northside Westmount.
The Minister admitted there was no proven correlation, Mr. Speaker. A reporter asked if at this point, is it intuitive rather than an actual study that proves that claim? The Minister replied, that's right. So my question to the Minister of Transportation is beyond anecdotal and intuitive evidence. Can he confirm that his department has not conducted any analysis to determine the actual economic impact of this ferry in this province?
The Honourable Minister of Transportation and Infrastructure Renewal.
Thank you very much, Mr. Speaker, and it's a pleasure to stand in my place here today and talk about the wonderful initiative that this government has undertaken by re-establishing that vital service into Nova Scotia. Let me tell you, Mr. Speaker, that the economic impact.
Order, please. The Honourable Minister of Transportation has the floor.
The economic impact, Mr. Speaker, is not required to be assessed by us. It is assessed by the capitalists of the province, who are showing by their investment in Yarmouth and area that this is a successful service. And Mr. Speaker, I'd like to table such evidence. It talks about the investment, the capital investment for the service, and the wonderful increase in tourism numbers that we see at that site.
The honourable member for Northside Westmount.
Thank you, Mr. Speaker, and I hope that's the economic impact study we're looking for, Mr. Speaker. I think Nova Scotians just want to know how much more money they may be asked to spend, Mr. Speaker. It's pretty reasonable. People want transparency around how their money is being spent, and this government promised to be the most open and transparent government in the whole world. Mr. Speaker, they want some economic metrics beyond whether room nights in the Southwest region are up or down, and they want to know that our scarce dollars are getting the best bang for their buck. If the ferry is going to work, Nova Scotians need to know the details. So, Mr. Speaker, I ask the Minister, is trust me good enough for the taxpayers wondering where their money is being spent?
The Honourable Minister of Transportation.
Mr. Speaker, I'm very happy to report in the past 3 years, over 127,000 visitors have come to Nova Scotia by virtue of our Yarmouth ferry. And I would also point out to the House and to the members opposite that the people in Southwest Nova do not begrudge others in the province. As an example, the ferry between Pictou and PEI, Caribou, has a subsidy from government of $12 million. We don't know the management fee, we don't know the passenger numbers, and we never hear any complaints about that service.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, I would like to ask a question of the Premier about long-term care. Back in 2015, the government announced changes to the long-term care wait list, and since then there's been a great deal of talk about how the wait list had been cut for people waiting for nursing home placement by half and so on. But a recent investigation has shown that those numbers, in fact, do not include people who are waiting in hospitals for long-term care, nor do they include adults who are in need of protection for reasons of neglect or self-harm. So, Mr. Speaker, will the Premier admit that the changes his government introduced to the keeping of the list in 2015 have in fact obscured and hidden the true number of people waiting for a place in a nursing home?
The Honourable Premier.
No, I wouldn't, Mr. Speaker. As a matter of fact, the list he's referring to includes all the very people that he thinks are excluded. That list is encompassing, Mr. Speaker.
The Honourable Leader of the New Democratic Party.
Records from a Freedom of Information request received by our caucus indicate that the government has no intention of building new nursing homes. The background documents related to the long-awaited continuing care strategy, which I'll table, show that the government isn't willing to get into the business of making long-term investments in new beds or facilities, that they believe an hour or two of care from a CCA is adequate for our seniors, and that anything else is just too expensive. Mr. Speaker, is the Premier willfully downplaying the need for more nursing home beds in order to avoid making the investments needed by the people of the province?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable for the question. As he would know, we've announced, Mr. Speaker, we're building long-term care beds both in New Waterford, Mr. Speaker, in Northside, and I look forward to the Honourable member's support. He's complained about those investments, Mr. Speaker, but I want to tell you, we're going to continue to invest in long-term care.
The Honourable Member for Cumberland North.
Mr. Speaker, the PC caucus and I personally support a ferry service between Nova Scotia and Maine. We are concerned, Mr. Speaker, though, about the business management of the contract. The taxpayers of this province expect us to ask questions about where their tax dollars are used. On several occasions this year, the Minister of TIR have referred to Bay Ferries as the agent of the province in negotiations. On January 24th, he indicated Bay Ferries acts as an agent for the province in discussions with Maine around the share of funding, and again on the 21st and on the 28th. My question for the Minister of Transportation, can he clarify the role of Bay Ferries as the role they've played for the province and define business agent as he sees it?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and I would refer the member in the House to the publicly disclosed funding agreement that exists between the province of Nova Scotia, which clearly articulates that relationship. Thank you.
The Honourable Member for Cumberland North.
You might want to read it too.
So the definition of a business agent is a person that represents a person or company in matters of business who can make business decisions for them. So my question to the Minister of TIR is, should a private business be negotiating and representing his department for the taxpayers of this province? The Minister has said there's nothing nefarious here. Yet the Minister refuses to be open and transparent when asked about questions about the contract. My question to the Minister is a private company making decisions on behalf of this government, and does the Minister not have the staff that can work on behalf of his department to make these decisions?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker. The importance of protecting third-party information is enshrined in the FOIPOP legislation as a mandatory exemption. Mr. Speaker, I can't say enough about, first, our senior staff who have negotiated this arrangement that we have to re-establish that vital service in the southwest Nova Scotia, nor about the operator, who is probably one of the more experienced ferry operators in eastern Canada, who operates several other services, Mr. Speaker. Thank you.
The Honourable Member for Pictou Centre.
Mr. Speaker, my question is for the Minister of TIR. And anyone within earshot, Mr. Speaker, you will know by now that the PC caucus does support the ferry. And I accept that applause, Mr. Speaker, and I personally support the service between Nova Scotia and Maine. And if I can gain the floor again, Mr. Speaker.
Order, please. The Honourable Member for Pictou Centre has the floor.
Mr. Speaker, I want to let everyone here know that I personally support the ferry between Nova Scotia and Maine. Mr. Speaker, for some time the Department of TIR has released 5-year highway improvement plans. These plans transparently, and I put quotation marks around that, Mr. Speaker, transparently lay out roads and highways that the department intends to improve, repair, or expand over several years. These plans allow Nova Scotians and companies to understand where money is being spent and why. If the ferry service is going to work, Nova Scotians need at least that level of transparency. My question to the Minister, does he feel that the 5-year highway improvement plan is a positive step for transparency in how taxpayers' dollars are spent?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and thank the member opposite for the question. Just let me say that, remind the member who proudly represents Pictou County that in the Northumberland Ferries arrangement in the 17-18 year, that the subsidy to that service was $12,442,589 of government money. Thank you.
The honourable member for Pictou Centre.
Mr. Speaker, I didn't realize I was talking about the ferry between Caribou and PEI. But, Mr. Speaker, on February the 14th, the minister said that his department considers the ferry an extension of the highway system. I can think of one major difference. The current ferry doesn't carry any commercial truck traffic. I can think of another major difference, Mr. Speaker. For highways, government releases regular reports on how work will be funded, what work will be performed, and a breakdown of where the money went. With regard to the ferry, the minister has been asked questions on funding and timelines for several consecutive minutes and responds with, "I don't know, I haven't any idea." Mr. Speaker, my question, is the minister satisfied that his answers on ferry expenditures meet the bar for transparency set out by the highway construction?
The Honourable Premier.
The honourable member just proves the government's point. He just very clearly laid out, Mr. Speaker, that we put a global number out for paving in this province. We award contracts in a competitive process, and we present the global number. I want to go back, Mr. Speaker. We had a competitive.
Please, the honourable Premier has the floor.
Mr. Speaker, we had a competitive process, Mr. Speaker, for the ferry service, Mr. Speaker. This contractor, Mr. Speaker, won the bid, Mr. Speaker. We're continuing to invest, and I want to remind the honourable member, just like with highways, we disclose the entire number, Mr. Speaker, but just like with highways, we don't go to every contractor and disclose how much, Mr. Speaker, it costs him to manage a project, Mr. Speaker. That's proprietary. That's how we get the best price, Mr. Speaker. That's why we're continuing to pave more roads and why we're investing in that international link to Yarmouth.
The honourable member for Cape Breton-Richmond.
Mr. Speaker, this PC caucus supports, and I'm going to continue to say this in the spirit of trying to negate a false narrative, or what we'd like to call as fake news. I personally support the ferry service to Yarmouth, and I know that my caucus does as well. The minister has stated that the ferry file is, and I would agree with him, an extremely important file to Nova Scotia, yet when asked last month about who is paying for work to prepare the Bar Harbour terminal for the ferry service, he was unfamiliar with the details. The minister said, "I don't know who is doing the work. I'm not sure who that would be." Mr. Speaker, does the minister agree that he should have perhaps a passing awareness of expenditures in one of his extremely important files?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. I stand in my place today and I can't say how pleased and happy I am to hear the resounding messages of support for the Yarmouth Ferry. Finally, Mr. Speaker. Finally.
The honourable member for Cape Breton-Richmond.
Mr. Speaker, I believe I have the floor. A day after the minister admitted that he had no information on the cost of or who is responsible for the Bar Harbour renovations, we learned that the minister's department in fact had quite a bit of information about who was going to pay for the Bar Harbour work. An executive within Transportation and Infrastructure Renewal wrote on January 22nd, the province of Nova Scotia is responsible for funding the costs, including the cost of upgrading the Bar Harbour ferry terminal property. I'll table that document. Again, several weeks later, the minister claimed he had no knowledge of who was responsible for costs. Can the minister please explain to this House if his department routinely makes significant commitments, millions of dollars worth, of taxpayers' dollars without consulting the minister?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. And I just want to re-emphasize that every year at the public accounts process that all costs associated with this service are absolutely released for public consumption, Mr. Speaker. And I would also say that I am very pleased to report that sales are brisk currently for the service relocation to Bar Harbour, and I'd like to table a document that speaks to that, Mr. Speaker. Thank you very much.
The honourable member for Dartmouth North.
Mr. Speaker, my question is for the Minister of Community Services. The roadmap for transforming the Nova Scotia Services to Persons with Disabilities program was presented to government in 2013. That report included a 5-year implementation plan to address a range of issues, including the need for people with disabilities to have access to the full range of affordable and accessible housing in the community, a range that is available to all Nova Scotians. Mr. Speaker, will the minister explain why the government has failed to implement the recommendations from the roadmap?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question. In fact, I reject her premise. In fact, we are busy working on that roadmap, Mr. Speaker, including the building of a number of small options homes, 2 of which have opened, 2 are about to open, and 4 are in the planning stages. Thank you, Mr. Speaker.
The honourable member for Dartmouth North.
Mr. Speaker, the Community Homes Action Group has repeatedly given the government a failing grade on this file. It has recommended an investment in at least 25 new small option homes each year for the next 3 years. The 2018 budget included funding for only 8, and now we are starting to see those 8 come to fruition. Last week, an independent board of inquiry ruled that the province had violated the human rights of Beth McLean, Sheila Livingstone, and Joey Delaney by not providing access to housing options. Mr. Speaker, will the minister be requiring each individual person with a disability in Nova Scotia to file a human rights complaint in order to ensure their human rights are respected?
The Honourable Minister of Community Services.
Thank you, Mr. Speaker. I think she may be confusing our government with theirs, which did absolutely nothing on this particular front, Mr. Speaker. This is not an overnight process. Every single person needs to have a plan going forward. You can't just stick people into residences as if they're going off to university. You have to make sure that people have complementary needs. We want to make sure they have the appropriate supports before you move out. You have to make sure their families are supportive. You actually have to talk to the people who want to move out and make sure they want to move out, Mr. Speaker. And Mr. Speaker, we're doing exactly that.
The honourable member for Pictou West.
Mr. Speaker, this government and the NSHA have claimed that some emergency room overcrowding can be blamed on seasonal blips, like a spike in flu cases or perhaps a lack of flu shots. We all know regional hospitals are particularly overcrowded. For example, the Valley Regional Hospital has experienced year-over-year demand increases of over 400% for emergency department services. My question for the Minister of Health: does he maintain that these spikes are a seasonal blip, or are we living in a new normal due to increasingly poor access to basic primary health care?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. Indeed, the pressures on our emergency departments in communities across the province is recognized. We have worked with the Nova Scotia Health Authority and our partners, the EHS, to find ways to improve the efficiency of the operations while ensuring that we provide the care that's needed by Nova Scotians, Mr. Speaker. The work can mention in terms of the improvements. We need only look across the harbour here, Mr. Speaker, to see what was implemented at Dartmouth General just about a year ago and the improvements with their offloading at the emergency department there, Mr. Speaker. We look forward to seeing more improvements like that in the near future.
The honourable member for Pictou West.
I hope to see so in the near future too, because daily we are hearing from Nova Scotians concerned about poor primary care resources and the domino effect this has on the rest of the province everywhere. Folks without family doctors are flooding emergency departments out of desperation. They don't have a doctor. We hear about walk-in clinics that are closing or worry they may have to close. People have nowhere else to turn, and it's having a serious impact on the staff and patients in emergency departments. So my question is, have emergency department staffing ratios for physicians and nurses been adjusted to cope with increased load of admitted patients as well as those presenting for care?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member raised the point, it's a point that I've been making since my time, and I believe my predecessor did as well, recognizing the important role that primary care access plays, Mr. Speaker, not just in the overall health of the population, but also in reducing pressures at emergent departments. Mr. Speaker, that's why we've been investing in recruitment initiatives, Mr. Speaker, expanding access to training seats at Dalhousie for nurse practitioners, as well as expanding access to residency seats, Mr. Speaker. We've expanded and reevaluated our incentive programs, Mr. Speaker, and we're seeing success. What the member hasn't highlighted, was the improvements that we've seen the last 4 months. We've actually seen more people attached to, Mr. Speaker, fewer people waiting, according to the data that we have, to get attached with family physicians, primary care providers, Mr. Speaker. That's based upon the good work that's been underway by our partners and the department for the last number of months.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. I've been raising the issue of ER closures at Roseway Hospital for as long as I've been elected. Still, we see regular closes with no change to that in sight. Since I last asked, the ER has been closed for 778 hours. That's 32 days, Mr. Speaker. The Roseway ER has been closed for more than a full month since I last asked about it. My question is, can the minister explain why the people of Shelburne still can't rely on their local emergency room to be open?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member's colleague highlighted, primary care is an important role that can help reduce some of the pressures. And I know that the member attended the opening of the Roseway Primary Care Clinic that we invested in, built an entirely new facility there right next door to the hospital. Mr. Speaker, in addition to that, I can advise the member and the members of the legislature that we have been working with our partners to come up with new ways to incentivize physicians to cover shifts, not just in communities like Shelburne, but communities across the province. Things like our locum incentive program, Mr. Speaker, which I believe about 62 days of coverage at Roseway specifically have been covered through that program. And in addition to that, Mr. Speaker, we have an emergency shift premium, which is also available to encourage physicians to cover those shifts, Mr. Speaker. We're looking at what we can do with our incentive programs to encourage physicians and other healthcare providers to cover these shifts in these communities.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, that collaborative care centre is welcomed in Shelburne County, but in February, for one of my constituents who spent 10 days in Roseway, that didn't help her. It started with a trip to the QE2, where she joined the endless hallway full of patients and paramedics. When it was determined there were no beds available, she was sent back to Roseway in the middle of the night. My constituent could not walk, and she was forced to lay on a gurney in the ER with a spinal injury for 4 days while waiting for a bed. During those 4 days, the ER was closed twice. So my question to the minister is, does the minister believe this is an acceptable experience for someone seeking health care in this province?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Certainly that's not the desired experience as described by the member opposite, Mr. Speaker. But what I can advise the member, as I've already done previously, is that we are taking the concerns of Nova Scotians. We are investing in our healthcare system, Mr. Speaker. We're investing in infrastructure. We're investing in incentive programs to ensure that we have the staff available to cover shifts in communities across the province. Mr. Speaker, we continue to listen to frontline healthcare workers to see what we can do differently to improve the situation. The challenges being faced, Mr. Speaker, in these communities for filling emergency department shifts and other primary care access, Mr. Speaker, are being felt in communities across the country. But, Mr. Speaker, Nova Scotia is certainly holding our own on the national context, and we continue to invest because we know there's more to be done.
The honourable member for Northside Westmount.
Thank you, Mr. Speaker. Mr. Speaker, the minister and his government keep assuring Cape Bretoners that their hospital redevelopment plans are going to help attract family physicians to our island. Potentially getting rid of the community hospital model doesn't bode well for these plans. Dr. Stephanie Langan in North Sydney recently pointed out that without the scope of practice, particular to community hospitals, there's little incentive for family doctors to train and stay in Cape Breton. And I can table that article, Mr. Speaker. So my question to the Minister of Health is, how specifically does the Minister plan to attract and retain medical students interested in family medicine in Cape Breton without a community hospital model?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would know, we're investing in new primary care infrastructure in the communities of New Waterford and North Sydney, Mr. Speaker. This infrastructure and the equipment available in these sites, Mr. Speaker, will provide the opportunity for new physicians and residents, Mr. Speaker, to have access to the equipment that they would be training with, Mr. Speaker, at their medical schools, and get that training, Mr. Speaker, with modern equipment, modern technology in the communities, getting access, Mr. Speaker, to provide top-notch primary care services in those communities.
The Honourable Member for Northside Westmount.
Mr. Speaker, under the existing community hospital model in Cape Breton, medical students interested in inpatient care and emergency medicine can put down roots. Now the government is rolling out a plan they haven't explained to us, and they're saying for us Cape Bretoners to trust them. They haven't demonstrated that the scope of medical services will bring any new family doctors once this dust settles. And doctors already practicing in Cape Breton are not confident they'll be able to stay. So my question to the Minister, if this government already has challenges retaining family physicians in Cape Breton, isn't this redevelopment simply, if you will build it, they will come?
The Honourable Minister of Health.
Not at all, Mr. Speaker. In fact, Mr. Speaker, the member would know, we have been recruiting and continue to recruit physicians for the Cape Breton region. We know that in the Cape Breton region, Mr. Speaker, there have been 8 family physicians and 7 specialists just since April of 2018,
Order,
Mr.
please.
Speaker.
Order, please. The Honourable, order, please. The Honourable Minister of Health.
Mr. Speaker, that includes 2 family physicians in North Sydney, Mr. Speaker. That's before we have new infrastructure, Mr. Speaker, built into the community, Mr. Speaker. So we know that we're listening to physicians on the front lines, Mr. Speaker, as we continue with the planning work for the infrastructure development and the very specific details that will come along with the designs.
The Honourable Member for Cumberland North.
Mr. Speaker, our caucus has heard stories of people who have gone to the emergency department with suicidal thoughts, and they've sometimes not been seen by a doctor or a nurse for up to 24 hours. If someone comes to the emerge department in this province of thoughts of having suicide or even attempted to take their life, sometimes no treatment is given. Emerge docs in this province have no acute care beds or not enough acute care beds or not enough psychiatrists for their patients to be seen. My question to the Minister of Health is why does this healthcare system not have services for acute care mental illness?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for bringing to the floor a very important topic in the healthcare system, one that perhaps, Mr. Speaker, we all know very much how important it is, and that is, of course, that of mental illness, Mr. Speaker. I can assure the member that her statement is categorically false with respect to the Nova Scotia Health Authority and the availability of acute mental health services. In fact, Mr. Speaker, the province does provide acute mental health services across the province, and Mr. Speaker, we provide services through the crisis helpline as well as in our emergency departments.
Please. The Honourable Minister of Health has the floor. The Honourable Member for Cumberland North.
Categorically false. I challenge the Minister of Health to talk to the emergency physicians in this province. That's embarrassing to have you say that. Emerge physicians and nurses are failing every day because they have no places to put their acutely suicidal, mentally ill patients. Yeah. I had someone 2 weeks ago that was sent home twice after overdosing. And their mother took them to the Moncton Hospital where they were admitted for 1 week and seen by a psychiatrist every day. They can't get that same care here in Nova Scotia. We have failed our people, and I can't believe he said that. mental illness be given a priority in this province?
The Honourable Minister of Health.
Mr. Speaker, as I'd indicated, and I've spoken to this in the past, the fact of the matter is we do take mental illness very seriously. Mr. Speaker, we continue to invest heavily to improve access, identifying issues, Mr. Speaker, early, providing the care, Mr. Speaker, and helping people develop the coping mechanisms and supports that they need to live healthy lives. Mr. Speaker, with respect to the clinical assertions, what I've been advised, particularly in an emergency room context, is that there are changing clinical practices, Mr. Speaker. These are practices where people may present at an emergency department looking for admittance, Mr. Speaker, but the clinical assessments and recommendations that are assessed personally in those instances, they make the clinical decisions, Mr. Speaker, as to whether to admit or to receive care in the community. Mr. Speaker, we rely on that clinical advice and practice that they bring to the people of Nova Scotia.
The Honourable Member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. Young people in Nova Scotia using the texting support service offered by the National Kids Help Phone discussed suicide the most out of any other province or territory during the first 6 months of this service. 2,565 young Nova Scotians used the service in the first part of 2018, many of whom were in immediate danger to themselves or to others. Mr. Speaker, does that fact that more than 2,500 young people needed crisis support in the space of 6 months not raise a huge red flag to this government?
The Honourable Minister of Health.
Mr. Speaker, again, I assure the member opposite and all members of the legislature that, in fact, the situation for youth who find themselves in such a situation is of concern. And Mr. Speaker, that's why we have been investing heavily. We've been investing not just through the Department of Health and Wellness and our partners, Nova Scotia Health Authority and the IWK, but through Education Department, Community Services and others. Mr. Speaker, what I think is important, though, is that those young people felt comfortable enough, confident enough in Nova Scotia to reach out, that we provided the access to those services for them to reach out to be connected, so that we could connect them to the help that they needed.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, since when is texting or calling somebody the answer to somebody's attempt at suicide? That is a disgrace, Mr. Speaker. 3.5 psychiatrists out of 16 is what we have in Cape Breton, just saying. Mr. Speaker, when young people contact the Kids Help Phone, they are connected with someone who is trying to keep them safe. If the child cannot stay safe, the volunteer can refer them to the RCMP or local police to take over the situation. But what happens after the police get involved? When does that child get access to sustained support in their community? I know in Cape Breton it's a very, very long time, and a phone call to the IWK doesn't cut it. Integrated youth services can provide that point of contact and keep kids from falling through the cracks. Mr. Speaker, when will the minister ensure that all young people in our province can access in-person mental health supports close to home?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Again, I'm pleased for the member raising her concerns. I hope she appreciates the investments we are making to do just that. Mr. Speaker, one of the recommendations that came to me very shortly after coming to this role was actually a recommendation to expand a program that started in Cape Breton in the members region called Caper Base. This is an adolescent outreach model, Mr. Speaker, that provides direct access to youth in community in partnership through our school systems, Mr. Speaker. I was pleased just a couple of weeks ago to announce that expansion in other parts of our province, Mr. Speaker. I believe it's been rolled out to over 40 additional schools now, Mr. Speaker, providing that care and that support, which builds upon other services like the Kids Help Phone and Strong's Families programs, which provides virtual contact points for those youth.
The Honourable Member for Kings North.
Mr. Speaker, my question is for the Minister of Health. Mr. Speaker, the NSHA has been increasingly moving away from overnight detox and relying on day detox programs. However, people suffering from drug and alcohol addictions desperately need detox to safely set themselves up for recovery. And spending a day in detox and then heading right back to the same community that was part of your addiction is not a recipe for success. So my question is, Mr. Speaker, to the Minister of Health, why was the decision made to switch from overnight detox to day detox?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. As I was mentioning in our discussion about mental health clinical practices, the member raises the point as it relates to addiction services. The fact of the matter is, as I've been advised, is that the clinical research has demonstrated that, in fact, while detox programs has been the norm for many years, growing clinical evidence shows that community-based treatment services is far more effective in the treatment, Mr. Speaker. Mr. Speaker, that would be what was driving any changes to the treatment in both mental wellness and addiction services.
The Honourable Member for Kings North.
Mr. Speaker, I'd like to ask the Minister to table that, and I can tell him that the people that I talk to on the ground who are doing this type of work in the province would say that night detox is desperately needed. And in fact, we know that detox requires support and guidance, and going into withdrawal can be fatal. So this is a very and being sent home at the end of the day and relapsing also can be fatal for an addict. So overnight detox is an important program to offer to ensure Nova Scotians are really able to begin the process of recovery. So my question is, will the Minister consider reinstating the overnight detox program?
The Honourable Minister of Health.
Thank you, Mr. Speaker. Mr. Speaker, it's my understanding that for those patients deemed clinically necessary to be admitted for detox, that service is still available, Mr. Speaker. But there's a fine line, or rather a distinction, perhaps, between individuals who present and requesting that service and those for whom the clinicians providing the decisions and making the care decisions, Mr. Speaker, who would choose that is clinically the right course of treatment, Mr. Speaker. So again, for those that are clinically deemed appropriate for a detox, my understanding is that it's still available in hospitals when clinically deemed necessary.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. And I just wanted to make a comment before I ask my question. When my father ran MSI, he could always tell us how many doctors were working in the province at any given time, and he knew which ones had died, retired, moved away, or just got fed up and stopped working. So I'm going to ask the minister perhaps to ask some of the people in his department if they can pull together that same information that my father had access to. Mr. Speaker, my question is to the Minister of Health. A few weeks ago, when the tentative deal was made between the VON and the government, a committee was also struck to prevent VONs from getting injured at work. VON nurses have the highest rate of injury among any nurse category, and of course there's a variety of reasons. The statistics around VON injuries are not new to this province, so it should not have taken 4 years for the Nova Scotia Health Authority to set up a committee to look into it. My question to the minister is, can the minister tell the House what he has done to reduce workplace injury for healthcare workers in Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And while the member raises specifically the question of a specific group, the VON staff, Mr. Speaker, the fact is we do know and we recognize that in recent years the growth of injuries and the pressures and the issues that creates broadly in healthcare and in particular in our continuing care sector. Mr. Speaker, contrary to the suggestion of it taking 4 years to establish, in fact, it's been established since I've been in, not just as recently as the contract, that joint efforts, the department, the health authorities, Mr. Speaker, Labour and Advanced Education, Workers' Compensation Board, all working together to find ways to improve the situation and reduce injuries of our healthcare workers.
The Honourable Member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker, and I thank the Health Minister for that answer, but it raises another issue. There's an awful lot known about injury prevention in this province, so the injury rate should in fact be going down instead of up. The CEO of the Human Rights Commission has advised us that 65% of all human rights complaints in this province center around the employer's failure to accommodate for those who have physical or mental disabilities. The greatest complaint is made against the Nova Scotia Health Authority, followed in secondly by the province, and then HRM. This makes sense as they're large employers, but I believe the authority responsible for the health of Nova Scotians should also know and do better, because the injury rate for all health professionals is on the rise. The question for the Minister is, can the Minister tell this House what, if anything, his department has done to address the failure of the Nova Scotia Health Authority to accommodate injured and disabled workers and to ensure that staffing levels are sufficient to prevent new Nova Scotia healthcare workers from getting injured at work?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And again, I thank the member for bringing the question forward. As I'd mentioned, we have invested in programs for education and equipment.
Order, please. Time allotted for oral